So hello everyone, once again welcome to my channel. So in today's video we talk about preeclampsia. So preeclampsia is one of the potential disorder of hypertension. It is also a disorder of pregnancy induced hypertension where there can be a life threatening condition for mother as well as for child. So it's a fatal condition, but with prompt action and with prompt treatment, the life can be saved for both. So it is important to identify what is preeclampsia, how it happens, what are the signs and symptoms, and how to prevent and treat it. So in today's video, we talk about all those aspects. So what is preeclampsia? So it's a new onset of hypertension and either proteinuria or other signs of end organ dysfunction after 20 weeks of gestation in previously normotensive women. So what does it mean that? So if a lady who is previously normotensive, like there is no complaint of BP, the lady is absolutely normal and healthy, but at the time of pregnancy, especially after 20 weeks of gestation, she started with a new onset of hypertension, that is BP ranges from 140 by 90 mmHg along with proteinuria or any other sign of end organ dysfunction, especially after 20 weeks of gestation, is defined as preeclampsia. So always remember, there can be increase in BP, that is 140 by 90. There can be presence of protein in the urine, and there, like, the time period for this is like after 20 weeks of gestation, and in a mother who is previously normotensive, that is defined as preeclampsia. But there is certain note also, like if the female is having hydatiform mole, or the female is having multiple pregnancy, like you can say twins or triplet, the features or the criteria or these symptoms may appear much more before than 20 weeks. So this is also one of the exception in preeclampsia. Now we talk about diagnostic criteria. So we talk about hypertension. The BP value ranges from 140 by 90 mmHg, where there is an increase in the systolic BP by 30 mmHg and diastolic by at least 15 to 20 mm of Hg. So for example, if the BP of the woman is like 110/70 last taken, and now it is found to be like 140 by 85 or 90, so that is preeclampsia. There is edema, like there can be pitting edema over the ankle even after prolonged hours of rest, like even if the mother rests for 12 hours, 14 hours, after that also it will not subside, because normal amount of edema is absolutely normal in pregnancy, but it goes like after a good period of time or after a good period of resting hours it will go. But here in preeclampsia, even after resting for 12 hours also it will not go. And proteinuria, that is presence of protein in the urine. So in normally, like the normal amount of protein which is excreted in the urine is around like 150 mg per day. So but in this condition, in this preeclampsia, the amount of protein is approximately around more than 300 mg per day. So it has to be like diagnosed timely. Then comes etiopathogenesis, like why it happens, how it happens, what is the pathogenesis behind this. So there is a clear cut reason behind this, that is endothelial dysfunction and vasospasm. So because of these two functions, all the mechanism is happening. So first we'll see there is an imbalance in the different components of prostaglandin. So prostaglandins are the hormones, and here there is an imbalance in the different components of prostaglandins. So as we say imbalance, so the one prostaglandin component, it is very high and one is very low. So there is no balance in between. So there is a deficiency of vasodilator prostaglandins, and there is an increase in the vasoconstrictor prostaglandins. The name of vasoconstrictor prostaglandin is thromboxane. So when the vasoconstrictor prostaglandins are more in the blood, what will happen? It will constrict the blood vessels. When the blood vessels got constricted, the area or the surface area get reduced. So the amount of blood which was flowing very easily, it will now get reduced because of the lower surface area. So the pressure increases, as a result of which the blood pressure also increases. There can be increased vascular sensitivity to angiotensin 2. Then comes your nitric oxide. So nitric oxide in preeclampsia, it decreases. So how nitric oxide helps? We'll see. So the main function of nitric oxide is to relax smooth muscles It also inhibits platelet aggregation and it prevents thrombosis. But in case of preeclampsia, the nitric oxide decreases. So when it decreases, it will not able to relax the smooth muscles. So the smooth muscles remains constricted, and when they remains constricted, they will increase the amount of pressure. They will increase the amount of stress. So that will leads to increase in BP also. There is inhibition of platelet aggregation, but because the value is very low for nitric oxide, there is no inhibition of platelet aggregation, and there is no prevention of thrombosis also. So thrombosis can be there. So because of thrombosis, again there are chances of increase in blood pressure. Then comes your endothelin 1. So there is a synthesis by this endothelin 1 is synthesis by endothelial cell, again which helps as a vasoconstrictor, and again if it is a vasoconstrictor, it will helps in rising of your BP. Then we have certain inflammatory mediators like cytokines, interleukins. So what they will do, they are inflammatory mediators. They will at the time it will cause stress, and the stress will lead to increase in BP. So because of these all factors, the BP will increase. Now we talk about edema. So for edema, the exact cause is not clear yet now, but still we have certain theories which proposed why edema occur. Edema occur because of the increased oxidative stress. So because of this increased oxidative stress, there is a endothelial injury. So there is an injury in the endothelial wall. Because of that injury, what happens? Because the wall is now rugged, the wall is now having injury, the tissues are torn away. So what will happen? There is an increased capillary permeability, and because of this increased capillary permeability, what will happen? The fluid will get accumulated, and when this fluid will get accumulated, it will cause edema. So that is the reason of getting edema. Now comes the reason of proteinuria, like why the protein is present in the urine. The reason is there is a spasm of afferent arteriole. So we all know that in glomerulus filtration in Bowman's capsule, we have afferent arteriole, we have efferent arteriole. So what happened when there is a spasm of the afferent arteriole? What happened? There is a change in the endothelium. That is again the lining. The change in the endothelium occurs, because of which it leads to endotheliosis. And because of this endotheliosis, what will happen? Again, there is an increase in capillary permeability. So what will happen when there is an increase in capillary permeability? There is a rise in leakage of protein. Usually what happens? The protein is like absorbed, and whatever is so yes, usually what happens? The protein will get absorbed, and but here what happens? Because there is increased permeability, capillary permeability, the protein will get leaked, and so all the protein which is leaked out, it will excreted in the urine, and that is the reason why the urine is filled with proteins in preeclampsia patients. Now comes the clinical features. So the clinical feature, the onset is very insidious. That means the mother is unknown about the condition. So gradually it will occur. It is not like it will happen on a sudden. It will take time. So sometimes mother is not aware about the reasons, because sometimes BP is also normal in pregnancy. Sometimes swelling is also a very normal sign in pregnancy. So sometimes even the mothers are not able to find it out whether it's a preeclampsia or it's a general physiological changes. So onset is very insidious. There can be a slight swelling over ankle, but it is more in the morning time. There can be a tightness in the ring, and there can be but this swelling will gradually increase from face, like abdominal wall, or to the all over the body. So if somebody is having these kind of signs, it has to be rule out. Then very, very important, alarming symptoms. So these are the alarming symptoms. If mother is complaining of these kind of things, please go and consult the doctor as soon as possible. So first thing is headache. So headache can be mainly in the occipital or in the frontal area. There can be a complaint of disturbed sleep every day. There can be decreased urine output less than 400 ml in 24 hours. So if the mother is complaining of this, please check for that. Epigastric pain that is associated with vomiting. There can be pain also due to hematoma formation. So sometimes pain can be in the lower extremities, or in the you can check for the pain in the vaginal area. So mother can complain of pain because of the hematoma formation. And eyes, there can be permanent blindness also because of the spasm of the retina. So sometimes what happen, because of the increased blood pressure, there can be retinal hemorrhage, so that can lead to sometimes permanent blindness also, or temporary blindness. So that all are the alarming symptoms. If somebody is complaining of some or other thing, utmost attention has to be given. Then comes the sign. So abnormal weight gain can be the sign, because usually in normal pregnancy there can be like on an average 11 to 12 kg of weight gain, that is distributed like 1 plus 5 plus 5. So that is 1 in first trimester, 5 in second trimester, and third trimester again 5 kg. But if somebody is having weight gain of more than that, and that is also like not equally distributed, so that is a sign of like preeclampsia. Increased BP, edema, there can be pulmonary edema, there can be abdominal examination. Like if you are doing abdominal examination, you can find out a scanty of liquor amini, or sometime IUGR also because of this condition. Then comes your investigation. So these are the investigation, like for I already told you. So urine should be checked for protein, and normally it is 150 mg, but in this cases the protein is like found to be like more than 300 mg. So please check for the ophthalmic examination, that is for retinal edema or retinal damage or retinal hemorrhage. Also check for the antenatal fetal monitoring, like fetal well-being, kick count, USG. These all has to be done for preeclampsia mother. Apart from that, blood value should be checked for serum transaminase, and that is found to be increased in preeclamptic mother. Thrombocytopenia also has to be ruled out, that is decreased amount of platelet count. So as I told you that there is a normally, like generally we have 1.5 to 4.5 lakh of platelet in our body, but in this mothers who is having preeclampsia, there can be a chances of thrombocytopenia. So please check for the decreased amount of platelet count in them. Check for the serum creatinine, that is found to be decreased like 1.1 mg per dl. Check for serum uric acid, that is also found to be decreased like 4.5 mg per dl. And there can be abnormal coagulation profile also, like PT, APTT, INR. So this all has to be checked for preeclamptic mother. Then we'll talk about the most important thing, that is complication. So complication is divided into two. It can be a maternal complication or it can be a fetal complication. So if we talk about maternal complication, if the preeclampsia is not treated on time, definitely it will lead to eclampsia, where along with proteinuria and hypertension, seizures can be there, coma can be there, and that can be a fatal condition for both mother and child again. So it has to be treated on time. Placental abrasion can be there, that is a part of antepartum hemorrhage. So premature separation of placenta can be there because of this preeclampsia. Oliguria, HELP syndrome, that is hemolysis, elevated liver enzyme, and low platelet count. This is a syndrome which usually occurs after 37 weeks of pregnancy, but in case of preeclampsia, this syndrome can be present in mother. And also there could be a chances of renal failure. If we talk about the fetal complication, so very most common complication which are seen in fetus is prematurity, birth asphyxia, and need for ICU. So these all can be the complications where both the lives are in endangered. So quick decision should be taken care. Then comes your prevention part. So how to prevent these conditions? First is regular antenatal checkup. Always, like during every visit, check for BP. If there is any abnormal BP variation, if there is any abnormal weight gain, that has to be taken care. Exercise should be like encouraged in the mother. Antiplatelet agent, if somebody who is like at high risk, so low dose of aspirin should be started, that is like 75 to 150 mg daily. And if suppose if the mother is again at high risk, we can start with low molecular weight heparin also. If the mother is having like lots of edema, we can start with furosemide Lasix 40 mg, but very cautiously, because sometime what happen, it may lead to oliguria also. So if somebody is starting with the furosemide or Lasix, so it has to be given only for the 5 days, and that is again with very cautiously. Calcium supplement should be given like 2 gram per day, that reduce the risk of hypertension. And antioxidants, very important, like vitamin C, vitamin E, zinc, this should be added in the diet. And decrease the salt content, because again the salt will increase the amount of your blood pressure. So please decrease the salt content. Last thing, we talk about hospital management. So very importantly, rest is advised for the mother for at least like complete bed rest. Mother should be on complete bed rest, and especially we are advising left lateral position. Why left lateral? Only because it will decrease the vena cava pressure. So when the vena cava compression decreases, it will automatically increase in your cardiac output, and the BP will like try to be remain in a normal values. Diet should be rich in protein, because as I already told you that there is a loss of protein through urine. So diet should be rich in protein, that is at least 100 gram of protein every day. Decrease salt intake and no fluid restriction. So fluid can be given in a liberal amount. Like diuretic, again I told you like you can use it with caution. So less 640 mg for 5 days initially we can start, if the edema is not subsiding or if the BP is also not like going down. So we can start with diuretic. Antihypertensive drugs we can start with. Most commonly used drugs are labetalol. So like initial dose is 100 mg. TDS we can give, or if required QID also, like 4 times in a day also you can go for. Nifedipine you can start like 10 to 20 mg BD, and hydrelazine, that is all three of them are antihypertensive drugs. So you can start with any of these agents if you want to like treat the patient. If you talk about the mode of delivery, you can try with both the mode of delivery. Like if the mother condition, if it is a mild preeclampsia, we can go with the normal vaginal delivery. But if there is any complication to the health of mother or child, you can definitely go with the normal, you can go with the cesarean section. So that's all about for this video of preeclampsia. So I have tried to cover everything related to preeclampsia, but still if any one of you is having any doubt, just try to put comment in the comment box so that I can just clarify your queries. Thank you so much.